I will be discussing anxiety-related disorders, and I would like to preface by saying just because you've experienced anxiety when public speaking or when waiting for results from your test to come back does not mean you're having an anxiety disorder. In fact, the response your body's having to those situations is natural and it's healthy. It's a good response to that certain stimuli, and it's a part of life. It's going to happen, and it helps us know that we're alive and well. So there's a definite line between having anxiety disorders and an anxious lifestyle versus having anxiety in certain situations. In fact, anxiety disorders are marked by distressing and persistent anxiety or by maladaptive behaviors that reduce said anxiety. So if you're continuing the same actions that result in the same anxious response, that is maladaptive behaviors to reduce your anxiety. People with social anxiety disorder become extremely anxious in social settings, hence the name. And in the book, one example is that a student experienced heart palpitations, tremors, and blushing and sweating in class, and when taking exams and giving presentations, or when meeting professors, because he feared embarrassing himself. There are 3 types of anxiety disorders discussed in the book, and one is generalized anxiety disorder, and this is when a person has no reason to worry about things that are out of their control, yet they continually get tense and stressed and uneasy when those situations come up. And then there's panic disorder, and this is when a person experiences panic attacks, and panic attacks are sudden episodes of intense dread and physical arousal. The third of the 3 is specific phobias, in which a person is intensely and excessively afraid of a specific object, activity, or situation. Thank you.
Hi, today I will be talking about OCD. OCD stands for Obsessive Compulsive Disorder, and this is a disorder characterized by unwanted repetitive thoughts, which are obsessions, and actions, which are compulsions, or both. As with anxiety disorders, we can see aspects of our behavior in OCD. For example, if you find yourself constantly cleaning, anxious about how your living space might look to your guests or other people, and you just find yourself cleaning one last time for several times, you might be dealing with OCD. However, some people might experience OCD in the complete opposite way. A lot of people think that OCD is just keeping things neat and organized, but some people might experience OCD in a hoarding disorder, which just means that they clutter their space with things that they find themselves that they can't part ways with, like blankets or antiques or other things. Another way people experience OCD is within themselves. They constantly check in the mirror to see what they look like, and if they don't like what they see, they might result to skin picking or hair pulling, just things that can harm yourself. People without OCD might think that they have OCD just because they like to keep their space neat and organized, and they like to have their house thoroughly cleaned every weekend, or because they can't part ways with a certain blanket or stuffed animal as a kid. But this is not the same case. This is not a disorder. For it to be considered OCD, it needs to occur frequently and disrupt with your daily functioning. Treatments for OCD include cognitive behavioral therapy, which just is working with a therapist and talking about your obsessive thoughts and trying to identify and challenge those thoughts. But there are some medications that can help you manage your symptoms, like selective serotonin reuptake inhibitors. But it is also good to know that you are not alone and there's always support out there to help you.
I'm going to be discussing somatic symptom disorder. So, somatic symptom disorder is a lesser-known mental disorder where a person focuses excessively on physical symptoms such as dizziness, shortness of breath, pain, weakness, or really any physical symptom to the point where the anxiety resulting from this constant fear causes a person to be incapable of focusing on anything else. This is not necessarily the same as hypochondria, which is the obsession and fear of having a serious undiagnosed medical condition. The two are similar, but where they differ is that those with somatic symptom disorder actually do experience the physical symptoms, but they believe that the symptoms are far worse and possibly the result of a serious illness. These people often end up doing tests and taking medications that they don't need, which can negatively affect their health, worsen the symptoms, and ultimately causes a cycle. Health concerns become such a central focus of one's life that it may lead to a legitimate mental disability. To clarify, somatic symptom is characterized by a high constant level of anxiety regarding symptoms, despite there being no proof of illness. The symptoms experienced are legitimate symptoms, but the cause of the symptoms is generally blown out of proportion and causes constant high levels of anxiety, which can often not be calmed even by doctors reassuring the individual that they are not seriously ill. Often people diagnosed with somatic symptom disorder are prescribed with antidepressants or anti-anxiety medications and referred to a therapist or specialist who can help them calm their anxious thoughts. Worst cases of somatic symptom disorder may cause an individual to be placed in a mental health institution, especially if health professionals are concerned that the individual may continue taking medication that will worsen their symptoms.
PTSD, post-traumatic stress disorder, is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. An individual may experience this as emotionally or physically harmful or life-threatening. It may affect their mental, physical, social, and their spiritual well-being. Examples include natural disasters, serious accidents, war, combat, sexual assault, rape, bullying. This is evident in the suicide rate among military members since September 11th of 2001. PTSD takes 22 service members every 24 hours. That means that in every class you attend today, someone loses hope. 154 a week, 616 a month, and 7,392 in a year to just suicide. What's missing? We feel alone in the trauma in our heads. Now we'll use song lyrics to explain questions and feelings about living with PTSD. This song by NF helped me in moving forward living with PTSD. When did I become so numb? When did I lose myself? All the words that leave my tongue feel like they came from someone else. When did I become so cold? When did I become so ashamed? Where's the person that I know? It must have left with all my faith. Where are my feelings? I no longer feel things I know I should. Where is the real me? I'm lost and it kills me. I'm scared to live, but I'm afraid to die. And if life is pain, then I buried mine. But it's still alive and it's taking over me. I want to feel something and I'm numb inside. But I feel nothing and I wonder why. I'm in the race of life and time has passed by. I sit back and I watch it with my hands in my pockets as the waves crash over me and I'm underwater, but I feel like I'm on top of it. I'm at the bottom and I don't know what the problem is. I'm in a box, but I'm the one who locked me in. I'm suffocating and I'm running out of oxygen. I'm paralyzed. One of the exciting and complicated difficulties of PTSD is that not one treatment works for everyone. Trauma is not a veteran issue. Trauma is a life issue. This is a human issue that would all do well to address, that anyone who endures trauma will be able to find hope and purpose on the other side, instead of simply accepting the label that is put on those who have dealt with a traumatic event and are living life as a slave to that label. If you go through trauma and you allow memory of what happened to equip you to serve others better and more fully do what you were created to do. Some will enable the memory to enslave them with a specific moment in time, absolutely. And they will not move forward because that memory of the past occupies every unguarded moment. They need to fill those moments diligently and deliberately with positive thoughts and actions instead of allowing an event to define their lives. and many will never find freedom from those memories. When we begin to believe that this is just the way it is and nothing will ever change, we condemn ourselves to a lifetime of drifting without purpose or direction on the sea of life. It becomes difficult to accomplish anything or fulfill the purpose for what we were created because we have accepted defeat as a way of life. While we cannot control what happens to us, we can absolutely control our responses. Do not allow your circumstances or your decisions of others to define you or determine where you will end up. Much can be taken from you, but you can never lose the ability to decide. When we finally decide that we are going to move forward despite trauma, we have taken the first step forward, growing into a person that can leverage their pain for the good of others. And once this decision is made, we continue with learning to be able to change our mindset. The goal is not to get back to where we were before the trauma. The goal is to grow through it and become more fully equipped to fulfill our God-given purpose. Trauma, even severe trauma, cannot keep us from moving forward in our lives and relationships unless we allow it to. We are not broken. There is hope.